Welcome, everyone, to the National Equine Conference call for January. Thanks for joining today. Thanks for your patience in allowing me to change the date for this call due to the way the holiday fell. It was hard to get speakers lined up for last week. So I appreciate our speakers today. And just a friendly reminder, these calls are recorded and are placed on the Equine Disease Communication Center's webpage after the recording within a week time period. And we will start our regular call schedule in February, which will be the second Thursday of the month at the same time. There will be a new Zoom link for all calls from February on for all of 2026 calls. So again, this call-in number will only be used today for this call, and then I will send out a call invite for the February call, which will be the same call-in number for all future calls. So just a couple updates regarding screwworm. I did put in the agenda the screwworm webpage, the new webpage that has been designed by USDA does have a new current status of the outbreak where they are reporting cases in a table for anything within about 400 miles of our border. So I do call your attention to that new webpage where the last update was on January 5th. And those cases are in Veracruz area. So if you are interested in the latest information, that is where you will be finding it on that USDA web page. I will also call your attention to the draft playbook that that they did post on the website as well. Comments have been submitted on behalf of the equine industry by several entities, and USDA is working through those. That is a draft playbook, and they are still working on finalizing that document. We do hope to have somebody on from USDA on a future call with us so we can get some of the equine specific questions addressed. So that's just a few of the screwworm updates and areas that we can put forth to you. And if you have any additional questions, again, USDA's webpage has your resources, and please feel free to reach out. And if there are more specific questions, I'm happy to bring those forth to USDA for future calls. As always, for future calls, I do welcome any suggested topics or speaker suggestions. So, with that, I'm going to roll into our agenda today. The first thought on this agenda for January, we decided we wanted to give opportunity for some folks to give us some updates and information on resources that are available to the equine industry. And the first one we're going to talk about is the American Association of Equine Practitioners Veterinary Direct Safety Net Program. And I'll turn it over to Sarah Coleman, who is leading that project for the AAEP. And Sarah is the executive director of the Kentucky Horse Council. Sarah, can you hear me?
I sure can, and I really deeply appreciate the opportunity to chat with you guys. I'm going to attempt to turn my screen on. If it starts to freeze, I will turn my camera off. I just always feel oddly talking to no one. My name is Sarah Coleman, like Katie Flynn mentioned, and I'm lucky enough to be basically the administrator for the Vet Direct Safety Net program. So this program was actually the brainchild of the ASPCA. And a couple years ago, they were trying to figure out why very clearly loved and cared for horses were ending up in the stalls of rescues and adoption organizations, but also in lower end auctions. They basically worked backwards, and they learned that the majority of the horses, their owners absolutely did not want to relinquish them at all, but they had some kind of financial incident within their household. So whether they lost their job, they had a medical emergency, they lost their home, they got a divorce, etc. And because we all know horses are horses, at that exact same time, their horse had some kind of immediate welfare need. So think they had a medical colic, they went neurologic, they had a bout of laminitis. And the horse owners basically said, you know, we knew we could not afford care for these horses, and we felt the best opportunity for them to get care was to relinquish them to an adoption or a rescue organization. So basically, ASPCA went back and they asked permission to reach out to the people who had relinquished their horses. And they asked them, they said, hey, you know, just talk to us a little bit. You know, what was the bill? Was it insurmountable on a good day when you all have a steady income? Or was it kind of a one-off situation where it was just this convergence of really bad luck, essentially? You had a financial emergency at the same time your horse had a welfare emergency. And overwhelmingly, the owners had said, you know, it was a one-off. It just, unfortunately, the way things kind of lined up, this horse needed immediate care, and we absolutely did not have the funds to be able to offer that care to the horse. So the folks at ASPCA went back to them and they had said, hey, if you had had just a one-time stipend of up to $500, would that have gotten you over your, you know, the financial hump enough that you would have been able to keep your horse? And overwhelmingly, the answer was yes. So the Vet Direct program is truly designed to keep owned horses in homes and out of the rescue and adoption stalls, leaving those open for horses that truly have nowhere else to turn and need to fill those stalls. So the Vet Direct Safety Net program is open to any AAEP member veterinarian. We deal very specifically with veterinarians and not with their clients, just so everybody's aware. And what it is it's a one-time stipend of up to $500 for your clients. And basically, we always say they have to check two boxes. Your two-legged client needs to have a financial need, even if that's just a limited income, if they're retired and on a fixed income. And your four-legged client has to have basically a welfare emergency. So it can include anything from stitches, staples, eye issues, neurologic, laminitis, basically along those lines. What it does not cover is anything that we all consider routine. It doesn't cover fall shots, spring shots, sheath teeth, routine blood work. It really is designed to help horse owners out of a tough situation when they have very limited finances. The program is super easy. If anybody is a veterinarian or knows a veterinarian who'd be interested in onboarding, they basically talk to me for about 10 minutes, and then I send them 3 pieces of paper as attachments to an email. They send that paperwork back, and they are enrolled in the program. It is designed to be very, very easy to use, honestly, because we know nobody has a lot of spare time. And a couple other things to note is it is also appropriate for euthanasias. We've had quite a few horse owners this past probably 18 months or so who they know their horses need to be euthanized. They're older, they're infirm, but they don't have the financial resources to euthanize that horse. So the Vet Direct funding is absolutely available for that situation as well. And what I think, one of the most exciting things I think is it's not by owner. So heaven forbid, if a veterinarian has a client whose horses run through a 4-board fence, and need stitches, staples, drains, etc., it is up to $500 per horse eligible, not per owner. So it is designed to be a one-time use stipend. So we hope that they would not need to utilize any Vet Direct funding after that one immediate welfare need. But it is a great program. We have seen it do a lot of really good work, and it is operating as it is intended. Once ASPCA figured out that the program would work as it was intended, which is to keep owned horses in homes, they basically gave the program with a stipend to AAEP to administer, knowing that AAEP was going to be a great steward of the funds. Just as a quick caveat, the funding is not available for any kind of rescue organizations, anything like that. What I always say is if somebody makes money off that horse, whether it's a lesson horse in a breeding program, a therapy horse, or part of a nonprofit, those horses are not eligible for Vet Direct funding. But it is an awesome program. I can tell you success story after success story about horses that have been able to stay in their homes from that up to $500 eligible to them. But if anybody has any questions, Keith just dropped the particular link in the chat. But I'm more than happy to answer any questions, and we would really encourage you, if you are a veterinarian who is an AAEP member or have any friends who are so, we'd love to get them enrolled in the program.
Hey, Sarah, one of the questions I received was you said it's available for euthanasia. Is it available for disposal costs?
We, if the only way it's really eligible for disposal costs, because we only reimburse the veterinarian, is if the veterinarian in some capacity facilitates that removal. So, but we always only write the checks to the veterinarian.
Another question, does the individual veterinarian or is it the clinic?
So this is the super awesome part. As long as there is one AAEP member in a clinic, in a multi-doctor practice, the entire practice is eligible for the Vet Direct funding.
There's a question in the chat, Sarah. Do they need to be enrolled before the need?
Yes, they do. There is a little bit of shades of gray. Like if you call me and want to get enrolled and I'm not able to onboard you into the program immediately and you happen to have a case that comes up, we would be able to backdate it because it would be my error, but it cannot be used on cases that have occurred before you're onboarded, multiple months ago.
Is there a list where folks can go to see if their veterinarian is part of this program?
No, there is not. They are more than welcome to ask their veterinarian, but typically the way we've been operating right now is that the veterinarian who's onboarded offers the funds to the client.
Are there any other questions? I'm not seeing any in the chat and I haven't seen any on my phone in a minute. So are there any other questions? Give everybody 1 second, Sarah. I'm not seeing any. Sarah, thank you so much for your time. I believe this is really helping our horses, as you say, keep them in their homes and keep them getting cared for by the owners that do care for them and really want to do what's best for them. So thank you for
Thank
your
you.
time. Thanks, AAP, for helping us with this program. And with that, I'm going to transition to our next speaker. Uh, Dr. Toby Pinn Woodcock, are you on the line?
I'm here, Katie.
All right, I didn't see you, so I was I was hopeful there. All right, Toby is going to give us an update for the AAEP's American Association of Equine Practitioners Infectious Disease Committee, and as she has now taken over as chair of the Infectious Disease Committee. So I will hand it over to you, Toby. Thank you.
Thanks, Katie. All right, so I'm going to give a quick update of accomplishments of the Infectious Disease Committee during 2025 when Dr. Donata was chair, and some things we have planned for 2026. So just to start off with, the Infectious Disease Committee's membership is very diverse, which allows us to do a lot of different things. We have some ACVIM diplomats, private practitioners, regulatory veterinarians, including SAHOs and foreign animal disease diagnosticians, members from academia, the Equine Disease Communication Center, industry, USDA APHIS, and USDF, and the American Horse Council are all represented. So it's a very diverse membership. During 2025, the subcommittee, the Field Diagnostic Guidelines Subcommittee, focused on bringing the equine acute infectious diarrhea diagnostic guidelines and the equine acute infectious respiratory disease diagnostic guidelines online. So those are now available on the AAEP's website under the resources tab. We also have neurologic diagnostic guidelines, and we hope in 2026 very soon to have our equine infectious abortion diagnostic guidelines published on the AAEP website. Each of the guidelines is accompanied by a flowchart, which is pretty user-friendly able to be pulled up kind of in a pinch to look up the diagnostics required for the different diseases that might be on the practitioner's differential list, so that they can make sure that they have the right collection containers, they're storing their samples in the right conditions, and asking for, of course, the tests that will give them the answers they need to make a diagnosis. So 2026, the abortion guidelines should be coming out. Our disease guidelines subcommittee, which was chaired by Dr. Alan Page, and in 2026 will be chaired by Dr. Sarah Eaton. They were very, very productive in 2025. They updated many of our disease guidelines, which are available under the resources tab on the AAEP's website. So in 2026, we hope to create the salmonellosis guidelines, and we'd like to update our foreign animal disease guidelines for New World screwworm, particularly just incorporating those resources that are being provided by other organizations like USDA APHIS, just making sure that veterinarians will be able to find them if needed in the future. And we'll continue to update other domestic disease guidelines as needed. During 2025 and continuing into 2026, our Outbreak Prevention and Preparedness Subcommittee, which is chaired by Dr. Brandy Burgess, had published a survey in the AAEP SPUR, which the link to this survey is here if there are any practitioners on the call that would like to take it. It's an antibiotic use and prescribing pressures survey. So as we know, antibiotic resistance in the environment could be related to prescribing practices. So the aim of this survey is to capture the pressures veterinarians face when prescribing antibiotics, and then provide insights to guide the development of practical tools for veterinarians, and then inform future research on prescribing behaviors. So this survey is still open, and we'll continue to circulate it in 2026, and then publish the results and move on with this project. And then the Infectious Disease Committee partners with the Equine Disease Communication Center. And I know Dr. Estelle will be speaking after me on the call, so I don't want to steal any of her thunder. But this partnership is very important. As you all know, in the recent herpes outbreak, there was important educational materials for horse owners provided through the EDCC as well as for veterinarians. And of course, the case reporting was essential. And we've all seen this chart on social media and online. And I know Dr. Estelle will tell us more shortly. The IDC has a New World screwworm task force. And in 2025, this task force helped provide a Wednesday webinar, virtual webinar through AEP and the Roundtable series. And it was called Eye on the Fly, New World Screwworm Update. And going into 2026, there are several IDC members who are involved in various preparedness discussions. So we'll be able to bring that information to to practitioners if needed in the future. And a 2026 webinar that we will be hosting, which is a response to several infectious disease outbreaks in the United States that have occurred recently, particularly equine infectious anemia and contagious equine metritis. We would like to host a webinar in the spring that will highlight common procedures that can easily spread infectious disease in horses. And we'll be doing this in partnership with Dr. Angela Pelzel-McCluskey, who is the National Equine Epidemiologist for USDA APHIS. Just make sure that we are all on the same page with how to do these common things in a biosecure way so we don't spread infectious disease. We have a new infectious disease committee initiative in 2026, which largely was influenced by the social media kind of hysteria surrounding the recent equine herpes virus EHM outbreak. So we would like to have a social media content committee that can produce bite-sized content for distribution on social media in the way that a lot of horse owners and others are receiving their news these days. We'll also have seasonal messages regarding equine infectious disease risk and as needed posts during disease outbreaks to combat the spread of misinformation on social media, including infographics and video clips. So that is the quick update and things to come in 2026 for the IDC.
Thanks, Toby. This is a huge resource for many, many, many in the industry when it comes to infectious disease, whether we're an industry member or a veterinarian. Does anybody have any questions, comments, or suggestions? Excuse me, for Toby and her committee or comments? Toby, can you just clarify on the guidelines? How frequently are they reviewed or updated? So if folks have an old one, what is considered current?
They are reviewed every couple of years or sometimes even as needed if an outbreak might be occurring. The most up-to-date versions of the guidelines are published on the AAEP's resources website section. So it is noted on all the guidelines, the most recent updated date. So if you look at yours and it doesn't match what is published on the website, then you might want to download the newer version.
Okay. Any other questions, comments? I'm not seeing anything in the chat. All right. If anybody has any questions, I would suggest you reach out to Toby and her folks so that they can address any needs the industry has related to infectious disease, whether that's coming from an industry perspective or a veterinarian perspective. And we really do appreciate all the hard work of all the committee members. Um, and Dr. White would like me to remind folks that the AAP guidelines are also linked on the Equine Disease Communication Center's website. So thank you for that. And thank you, Toby, and everybody in your group for all the great work you all do.
Thank you.
So, with that being said, our next speaker is going to be Dr. Krista Estelle, who is with the Equine Disease Communication Center and Dr. White. And she is going to talk about the EDCC reporting and leading into the EDCC reporting and the latest EHM outbreak that occurred at the end of last year. Dr. Estelle, I did see you. Wait a minute, where'd you go?
Hi there. Yes, hi. Thanks
All
so
right,
much.
there you go.
Sorry, it's a clinical day for me, so I'm trying to balance a couple of things at once, as per usual. So hi, everyone. First, I have a presentation regarding the EDCC, and I'm really excited to be giving this to our state animal health officials because you guys contribute so much to the EDCC. So let me try and share my screen right quick. Here we go. Okay, so this is a how-to that I have for veterinarians in particular. Hold on. This is a how-to I have for veterinarians in particular, and was able to present this to our vets at AAEP. And so this has gone out to our general practitioners. But of course, our state animal health officials are really important in getting this information out there. So let's see if I can appropriately share my screen one more time. There we go. Okay, here we are. Does that look right to you, Katie?
No, sorry, we're in that present now. It's good. You're good.
Okay. Yay. Okay, great. Good. So thanks again, everyone. I just wanted to talk first a little bit about what the EDCC is and what our official mission statement is. Um, we are a communication center, and we're a tool for all different types of horse people. So that's veterinarians, it's professionals, and it's also your general pleasure horse owner. Now, our mission statement is to improve the health and welfare of horses, and we accomplish that by monitoring infectious disease outbreaks and then communicating those real-time alerts to help prevent and stop the spread of equine infectious disease. So you can easily access the EDCC through a couple of different ways. We have a website, and that's equinediseasecc.org. Or we also have an EDCC app, which is available on both Apple and Android platforms. The website is pretty easily navigated. There's lots of different options for getting to all different types of places. There are tabs in the website header, and that's consistent across pages. So there in the blue, you can see all of the tabs that are across that header, and you can access different parts of the website there. And there's also a series of quick links that you can see in the middle of the homepage. So the goal of the EDCC is to make veterinarians and horse owners aware of current disease outbreaks or cases that might affect the disease risk and the horse activity in that particular location. The cases are submitted online by veterinarians or by state animal health officials. And importantly, you have to be a veterinarian or a state animal health official for us to post or publish a case to the EDCC. As far as the alerts go, the 3 most recent alerts are posted at the bottom of the homepage, and there's also a running list of disease alerts that are found on the side of the alert page. So this is an example of an EHM case that was reported to us by the team at Wisconsin. And you can see particularly in this case, it's important to get this information out here as soon as it's offered to us because we've got 12 potential exposed horses in this case. And so it's nice to have a source of information for these outbreaks that is reliable and accurate. But we can only provide that if the information that we're getting is up to date and is a good source of information. So where else you can find disease alerts, there's a comprehensive searchable list with the US state and the Canada province maps on this disease alerts page. So you can search by state by entering the state into this searchable area. You can just click on the state and then you can look particularly for particular diseases and see what the disease activity is for the reporting. So for example, West Nile virus during our arbovirus season, you can type that in and you can see all of the states that have reported West Nile virus. So the question is, when do I submit a case to the EDCC? So this does not have to be a state reportable, actionable disease to be reported. All cases of infectious disease can be submitted to the EDCC. This part of the talk was specifically designed for our veterinarians, our primary care veterinarians. We recommend that any disease that's reportable in their state, the state animal health official or veterinarian is contacted first so that you guys are made aware of the disease, and then the EDCC is contacted second. And this allows the state vet to institute a quarantine or take action on the outbreak before the disease becomes public knowledge. So we will not post information about a reportable disease until we've had confirmation from the state animal health official that they're aware of the case and that they are ready for us to post that information. We strive to make this as up to date as possible. And so if you click, if our veterinarians actually click on the map They can see what diseases are reportable, and they can also access the state animal health website. And then that should have contact information for our state veterinarians. So if you've had some personnel changes, if you'd like, please go ahead and have a look at the ADCC and make sure that we're up to date with your information. We're happy to update that information, especially if you've got a change in the diseases that you consider reportable in your state. And then if you yourself are submitting a case, if you have a case that you want to report, you click on the Submit a Report link in the website header. And this directs you to a fillable form. And if you could please include as many case details as you've had, and then you press the Submit button, you get an email confirming the submission. So if you go through this and maybe you walk away from your desk for a little while and come back and then submit it, you can confirm that we've received that notification by you will get an email that confirms your submission. Every submission that occurs is reviewed by one of the veterinary teams. So it's either me, Dr. White, or Dr. Flynn is reviewing those submissions. We then post that alert to the website and our Facebook page, as well as shared to our email listserv. We are not currently on TikTok or Instagram, and I don't think that we've got immediate plans to post our disease alerts on any other social media platforms, but we are on Facebook. As we saw during the recent outbreak in Texas or centered in Texas, our Facebook page got a lot of hits as a result of that outbreak. Because we're giving this information, we really appreciate any updates that you guys might have. So if you find out that a horse has recovered, that's wonderful. If more horses test positive, then we would love to share that information. And then, of course, if a horse does get euthanized, then we're happy to update the alert in that way too. In addition to reporting disease information and outbreak information as it happens, we also work to synthesize information regarding multi-state outbreaks in the hope that we're providing accurate, updated case counts as we receive them. And so this was our chart that we used for the EHM outbreak. And we had this as a news alert, and you could click on it. And every time we got a new submission, we would update our chart so that we had an accurate reflection of the cases that were being reported to us out in the field. In addition to communicating alerts regarding infectious disease, the EDCC is a reliable source for accurate information. And I appreciate that a lot of state animal health officials might not necessarily have done a lot of equine practice. It's also really hard to stay up to date with infectious disease. You know, we're updating our knowledge base more or less daily. And so we've got links to AAEP resources. And then on EDCC, we have disease fact sheets that are written at the level of the intelligent layperson to try and spread accurate information about the disease of concern. And you can find these by going to the infectious disease tab in the header or the quick links, and you can also search for those individual diseases. So as I said, we do have links to additional resources. We use the AAEP resources a lot, also USDA links as well. We found that there's so much inaccurate or outdated information on the internet, right? So Google and the AI answers that you get are often not correct or not update. So we do our best to provide updated information to help our veterinarians, equine professionals, and horse owners educate themselves on infectious disease. We also do our best to help prevent infectious disease. So a good biosecurity plan is the first step, but even our professional horse people might not know where to start. So we have biosecurity guidelines that are available for individual diseases on the disease fact sheets. And then we've got some more comprehensive biosecurity recommendations for various types of horse events, facilities, and operations, and that's present under the biosecurity tab. If clients are not sure where their facility fits among these different options, they can click on the biosecurity risk calculator, and that will give them an idea of the type of risks that exist and how they can improve their facility's response to infectious disease prevention. So this is just a little plug for us. We're entirely supported by financial contributors from all segments of the horse industry. And so if you are at one of those cocktail parties with wealthy donors, please throw them in our direction because we strive to provide a level of information that's comprehensive, up to date, and readily available to all horse owners. And we can only do that through support. Um, so with that, I'm happy to answer any questions, particularly about the EDCC.
So I'm just going to read one of the comments we got in the chat is Instagram/Facebook can be a single post to both sources. I do recommend adding it as it requires very minimal lift. So we'll put that on Leslie's to-do list. Leslie is the Equine Disease Communication Center manager, and we will have her look into that.
You're
Are there any?
absolutely right. My Facebook updates to Instagram without me wanting it to. So yes, you're absolutely right. We should totally do that.
Is there any other questions out there? One thing I just wanted to bring to light, during the outbreak, EDCC received a lot of messaging through Facebook and a lot of media inquiries. That is another resource for folks if you are getting questions that you can't, you would like somebody else to answer them for you. That is also an ability of the EDCC, so can send them that way. The one other thing I would like to mention is EDCC, in addition to with the American Association of Equine Practitioners, did do a webinar that is on the AAP's website regarding the incident. So you can actually go into the website for AAP and find that webinar for right before the outbreak. And then AAEP at its recent convention did do an EHV Ask the Expert panel. And that Ask the Experts panel for EHV was focused on this recent outbreak. And AAP has been kind enough to post that as well, outside of the restrictions of the conference participants. So anybody can access that, and that is on the AAEP website on the on-demand section. So anybody that would like to have some of the information that was presented to the equine practitioners at the annual meeting under the Ask the Experts panel is welcome to click that link, as well as the one that was done prior to the convention right at the time of the outbreak. So from that perspective, there is additional information out there and resources that were focused on the outbreak itself. And with that being said, this is a resource for all of the industry, as Dr. Estelle said, and we would certainly want support from all of the industry and spreading the message that this is a resource for the industry. I believe I'm sure Nat, Dr. White can quote the numbers of millions of hits that we had during the outbreak. And we did see it being used in an appropriate manner. However, as Dr. Toby mentioned, that there was still misinformation out there. So we're going to continue to fight these battles of making sure accurate information is out there. And if we can, as an industry, support and promote the Equine Disease Communication Center as the factual source, I think that helps us all making sure the messaging is correct and consistent. So with
Well,
that, I will open it
yeah.
up for comments.
If you don't mind, I'd love to chime in about something. I think especially in these large outbreak and Texas has a lot of resources with their animal health center commission. They have epidemiologists. They've got a lot of resources, and even they were overwhelmed. And it is the state veterinarian's job to take care of the boots on the ground outbreak, try and contain the disease. We would love to help with the communications. And so if those cases are submitted to us quickly, then we can be in tandem with what we're reporting and we can be a resource for all of this accurate information that clients have. I mean, they have basic needs about difference between a horse that is EHV1 positive versus what does EHM mean, survival rates, what they should be treating their horse with, which we also won't answer, but we'll give them general outlines of what we, general recommendations. And so we would love to take that off your plates. Report the diseases, please, and please let us help you as best as we can.
I'll comment on that. This is Nat White. On the 20th of November, we had 1 million hits to the EDCC Facebook page. And on 3 weeks from that time, we had 4 million. So the information is getting out there. And and it's all information that was submitted by veterinarians. It's accurate and complete. So like Krista said, we'd love to be able to do as much of that as we can.
Thanks, Nat. Thanks, Krista. Any other comments or questions? Well, I expected a few more questions or comments. I guess we're doing our job then. Any other questions or comments regarding EDCC or the communications? Okay. Well, I appreciate your time, Krista, and Nat and Leslie for all you do for the EDCC. I'm just going to round it out here with a couple comments because we seem to have gotten through the call quicker than I anticipated today. So thank you, Krista and Nat. So just as announcements, our next call will be February 12th. So we're going back to the second Thursday of the month for the rest of the year. I will send out a new conference call Zoom link for all calls for 2026. Next month, we will also, we already have the topic of vesicular stomatitis, as there have been an increasing number of cases being detected specifically in Arizona. So that will be coming on board on our next call. We also hope to have an update on screwworm and the protocols and processes that might impact the equine industry moving forward. So those are the two topics for sure that will be on next month's call agenda. If you do have any other topic suggestions or speaker suggestions, please feel free to send them out to me. I'm happy to look for other speakers and topics if you all have some suggestions. And I apologize for not having my camera on today. I am remote, so I wanted to make sure that I had a good connection. With that, I'm going to say, are there any other questions, comments, or concerns? If not, I'm going to give you back some of your day to day. Happy New Year, and we look forward to a successful, prosperous 2026. Thanks everyone for joining. Have a great day.